Hey guys, this is Cesar with Nursing School Made Easy. Today's lecture is going to focus on diabetes mellitus, more specifically on type 1. A big shout out to Arctic Computer Repair for donating this iPhone 6. It's going to come in super handy because later on we're going to be taking a look at different equipment that you're going to be using for testing glucose levels. Okay, so it's going to come in super handy. So again, shout out to Arctic Computer Repair. Thank you very much. Now, diabetes, I'm going to try to focus on the main concepts, on the main things I need to know for the NCLEX exam. Just remember, with diabetes, you have so many complications, so many problems, so it is very important that you understand diabetes and the difference between type 1 and type 2. But on this lecture, we're going to focus on type 1. Again, we can do a lecture for many hours on diabetes, but again, we're going to narrow it down to the most important things that you need to know. We're going to keep it very basic. So let's get started. Type 1 diabetes. Now, the thing that you must understand is that diabetes is it results from an abnormal insulin production. Okay, so that is number one, abnormal insulin production. Now, in type 1 diabetes, this is due to destruction of the beta cells in your pancreas and the islets of Langerhans. So again, it is due to the destruction of beta cells in the pancreas. Now, this is performed or due to your T cells destroying your beta cells. So your immune system will attack again your beta cells, and typically this is a result of some type of viral infection. So this used to be known as juvenile onset diabetes because it occurred in very young patients. Okay, so the patient would get sick, some type of viral infection, and that would cause their T cells to mistake their beta cells as a problem, as an enemy. So the T cells would then begin to attack the beta cells, and if you have no beta cells, you cannot have insulin production. So you must understand this. So again, in type 1 diabetes, you have no insulin production. Now, what exactly does insulin do? What's its function? The long story short, insulin allows for your body, your cells, to use glucose, to absorb glucose, to store glucose, because remember, you use glucose for energy. Your brain specifically uses glucose as an energy source. So therefore, you must be able to use glucose. So it is very important. And in order for you to use glucose, absorb glucose, store glucose, you're going to need insulin. Okay? Now, I want to talk about, for example, something like lactose intolerance. Now, this is something completely different, but it ties in somewhat with this lecture. For those of you that suffer from lactose intolerance, what happens when you drink milk products, when you drink cheese, or excuse me, when you eat cheese, drink milk, milkshakes, ice cream with milk in it? What happens? If you are lactose intolerant, you will drink it, and you'll notice that a couple of minutes later, a couple hours later, you'll have an upset stomach, and then you'll have something like diarrhea or very watery stools. Now, the reason for it is because your body does not have the enzyme that breaks down lactose. Okay, so you cannot break down lactose. So what ends up happening is your digestive system gets rid of it, and you end up with diarrhea and abdominal problems. Those of you with lactose intolerance will know what I'm talking about. So again, your body cannot use it, therefore your body gets rid of it right away, and you end up with very watery stools. Now, diabetes is a little bit similar to that, in that you must have insulin in order to use glucose. Okay? if you do not have the insulin, your body will not be able to use glucose, and more specifically, your kidneys will get rid of glucose. So here's my kidney, renal artery. This is going to attach to your aorta, so you can have one on this other side. Now, you can have your ureters, and they'll come to your bladder. Okay, now again, you have no insulin production, therefore you cannot absorb glucose. So glucose is going to be filtered by your kidneys, and you're going to dump it into your bladder. Now what's going to happen, water will also follow. So you're going to have large amounts of water in here, because again, water is going to follow the glucose molecules. And what will end up happening is this patient will be voiding constantly, or something called polyuria, and we'll get into this when we talk about our signs and symptoms, but they will have polyuria. And again, it is because their body cannot absorb glucose because there is no insulin production. You must understand that. Now, another thing that you have to understand is that the glucose molecule is a very, very large molecule. This glucose molecule should not be dumped into the bladder, and it should really not be excreted. This glucose molecule causes damage to the kidney, and later on will result in kidney disease, or chronic kidney disease, or renal failure. Okay, again, the glucose molecule is a very, very large molecule, and over time it will cause damage to the kidney, and then we'll run into some complications that we'll talk about a little bit later, but understand that. Again, the glucose molecule is very, very damaging to the kidney if it is not able to be absorbed due to insulin deficiency. Now, there's a couple things that you must know before we move on. There's other things that can cause a rise in glucose levels, and we've talked about these in previous lectures. So I'm just going to do a quick review. Number 1, glucagon. Number 2, epinephrine. Number 3, growth hormone. Number 4, cortisol. So all of these increase blood glucose levels or cause hyperglycemia. They antagonize or they decrease insulin effects. Okay, so again, these are going to cause hyperglycemia. Glucagon, we'll talk about that a little bit later. So okay, this is going to increase glucose levels. Epinephrine, fight or flight response. You need energy if you're either going to run away or stand and fight. So again, this is going to increase glucose levels. Growth hormone, we talked about this when we talked about acromegaly. Okay, so again, that is going to increase glucose levels, and that makes sense. If you're going to be growing, you're going to need an energy source, glucose. So again, growth hormone will increase glucose levels. Cortisol, we talked about this in Cushing's. Okay, and how that's going to again increase glucose levels. So again, anytime you are in a stressful situation, whether it's surgery, emotional stress, burn, some type of trauma, this is going to increase your cortisol levels, and as a result, it will again increase your glucose levels. So make sure you know these for the NCLEX exam. That was really, really brief. Now let's move on to some complications. Now again, I talked about how in diabetes you have so many problems. I'm just going to talk about them very, very briefly, because we could go into just hours and hours on these different types of complications. So I'm just going to name them off. Number 1, DKA. Number 2, hyperglycemia. Number 3, renal failure. And again, this is due to that large glucose molecule. Or chronic kidney disease. Number 4, retinopathy. Now this is most likely due to number 5, hypertension. Okay, the blood vessels in the eyes are very, very small. If you have hypertension, those vessels have the potential or a very, very high likelihood of rupturing, causing retinopathy or visual changes. Number 6, decreased wound healing. This has to do, part of it, with cortisol. Again, cortisol has, it causes immunosuppression, decreases your immune system. Not only that, but you have glucose in the body. Bacteria loves glucose, so you're going to have decreased wound healing time. And along with this, you have the potential of suffering from something like gangrene. 7, stroke. 8, again, the stroke will be most likely due to the hypertension, causing problems with the vasculature in the brain. Number 9, coronary artery disease, or CAD. Number 9, cardiovascular disease. Number 10, atherosclerosis. Again, that would lead to heart disease, and that would lead to problems with CAD and stroke. That also can lead to hypertension, which again could cause retinopathy. The increase in blood pressure could again result in renal failure, kidney failure. So you can see how all of these complications, again, diabetes, I cannot talk about it enough because it causes so many pathologies to your patients. So please be sure that you know how and why diabetes is so severe. So now let's get into some signs and symptoms. And let me change pens here because I was not wanting to work. So signs and symptoms. We talked about one briefly again, polyuria or nocturia. If they're constantly getting up at night to go void, go pee, they're going to be fatigued. If you're constantly voiding, constantly peeing, you're also going to suffer from probably dehydration if you cannot keep up with the demand. Because you are dehydrated, you're peeing a lot, you're also going to be thirsty all the time. You're going to be wanting to drink lots and lots of fluids. You're going to suffer from something called polydipsia. Okay, increased thirst, increased drinking. So this is a kind of a recurrent problem. You're going to be drinking a lot, you're going to be peeing a lot. Polyphagia. Hungry all the time. Eating all the time. If I could learn how to spell hunger. So again, this happens because you are unable to break down or utilize glucose as an energy source. So your body will then begin to break down fat. Now this would result in a couple of complications. Number 1, weight loss. Your body will start to break down fat as an energy source, and the other thing it will start breaking down is protein as an energy source. Now remember that your muscles are made out of protein, so you're going to have muscle loss. Weight loss, muscle loss, again, this will lead to weakness and fatigue. Again, with fat breakdown, you will end up with something called ketone body production because you're breaking down fats. Now, if this occurs and is not corrected, then you will later on end up with something known as ketoacidosis or DKA, diabetic ketoacidosis. Again, that is due to breaking down fats. And again, you're breaking down fats because you cannot use glucose as an energy source because, again, you do not have insulin. Number 4, if the patient is beginning to suffer from something like a DKA, diabetic ketoacidosis, one of the first things that you will notice is Kussmaul's respirations, rapid breathing, Now this is very, very important because that lets you know that their health is beginning to decline very, very rapidly. So be aware, monitor for these Kussmaul's respirations. Again, very, very rapid breathing. Along with this, you'll have nausea, vomiting, wanting to throw up constantly. Again, that would be, these two would be very, very highly indicative of diabetic ketoacidosis. And we talked about this weakness. Talked about weight loss, fatigue, abdomen pain. Fruity breath. Somebody told me it actually smelled kind of like juicy fruit. If you've ever chewed juicy fruit, that is what their breath would smell like. That is due to the acetone in the body. Number 9. Okay, we talked about this decreased wound healing. This is very important because some patients run into some problems with, for example, loss in sensation, and that has to do with some neuropathy, nerve damage, again due to the high glucose levels. This is a problem, especially if the wound is in the feet. This is especially even more so important if the patient is obese and cannot see their feet. There's some type of open wound, the wound goes unchecked, the wound becomes infected, you run into some problems like sepsis, gangrene again. So this is a very, very big one, decreased wound healing. So make sure you check your patient for any types of open wounds, and if they do have any wounds, make sure that they are reported to the physician immediately. Now, one thing here, patients should also be informed to refer to a podiatrist anytime that they're going to get their toenails clipped, because again, you do not want to cause any open wound, so you want to be very, very careful when they're cutting those toenails. So most likely they will be referred to a podiatrist to get those toenails clipped. Okay. Now, what are some diagnostic studies? Again, I'm just going to go through these very, very briefly. Number 1, A1C, more specifically hemoglobin A1C. This would be greater than 6.5%. Greater than or equal to, again, 6.5%. Okay. Now remember that for the A1C, they do not need to be fasting. So again, MPO is not required. So this is very important, okay? And typically, the A1C checks sugar levels for anywhere between 2 to 4 weeks. Number 2, fasting plasma glucose. Now, this would be, again, fasting plasma glucose greater or equal to 126. Now, this is, again, fasting, so the patient should not have any caloric intake for a minimum of 8 hours. Okay, or MPO for 8 hours. It's not going to do you any good if they had a huge meal, cheeseburger, fries, and a pop, and then they went in and did this exam. It's not going to be an accurate study, so they must be told, they must be informed, they must be educated that they must be MPO or have no caloric intake for a minimum of 8 hours. The other study is the oral glucose tolerance test, and we will focus on this a little bit later on when we talk about maternal child. Okay, so the oral glucose tolerance test. Number 4, if you do a UA, you will find large amounts of glucose in urine. Now again, this is not supposed to occur. Now, let's focus on some drug therapy. And here we're going to talk about the insulins, but before we talk about the insulins, we're going to talk about some of the equipment that you may be using. So here are a couple of lancets that you will be using to get a finger stick. Now, if you've never seen these, please make sure you practice a little bit or ask how these are used. So basically, here you will have this button here, and here's where the little blade comes out of this portion here. So what you will do, and this is a newer version, I think I've seen this more nowadays. Before, this is what was used in most settings. And this, the way you use this is you, if I can get this to work here. So this is pulled out, and when you press on this, this will release lancet and you'll poke. Now make sure you, when you do use this, that you use the fatty portion here on the side, okay?